All right. Well, let's get on with the show this morning, shall we? Everyone knows that losing weight, it can be a struggle. Sometimes diet and exercise aren't enough to get your desired weight loss goal.
Absolutely. But now there's a new non-surgical balloon procedure that can help. We welcome Dr. Stephenson with Carolina Digestive Health Associates to the show. Hello, sir. How are you doing?
I'm doing great. Thank you for having me.
Yeah, great to see you. Okay, tell everybody about this. It's a non-surgical procedure to help you lose weight. It's called Orbera. Explain what it is.
Well, we're very excited about this. It's actually an intragastric balloon, the Orbera intragastric balloon. It's been recently approved in the United States. It's been used in Europe and in South America extensively with very, very good results. It's a balloon that's introduced into the stomach using a gastroscope. And under visualizations, we're watching the whole process. It's expanded in the stomach, and it gives us a feeling of satiety or feeling full. And as a result of that, you eat less. And the portions are controlled, and you lose weight.
So it works like that because you can expand the balloon. Can you expand the balloon to different sizes of that?
Well, it's recommended to expand to a given size, but again, everybody's stomach is different. That's why we're doing this endoscopically. We look at the stomach first. We see who's a suitable candidate. We expand the balloon, and it creates, if you can see here, almost a grapefruit size object in the stomach. Which gives us it allows the patient to eat probably a third of what they're normally used to eating.
And as you mentioned, they will feel satisfied and full.
Sure. Most diet programs are based on decreased caloric intake or portion control.
Exactly.
And I think a lot of people will fall off the wagon with these programs if they don't start seeing results fairly quickly. The exciting thing about the Orbera balloon is that you will lose about 3 times the amount of weight that you will with a plan that's just based on portion control and exercise. We leave the balloon in for a period of about 6 months maximum.
Well, that's very encouraging. You're right. When you start to see those results so quickly, it does motivate you to keep going.
And I think most people, will stop a diet program if they don't see results quickly. They'll just go back to their bad habits.
Dr. Stephenson, who is a good candidate for this?
Now, this balloon is indicated for people with a BMI between 30 and 40. People below and above that don't really fit the indication, but about 35 to 36% of Americans are in that obese category, between 30 and 40. And obviously, they have to be motivated to go beyond just the balloon and adhere to a regimen of diet and exercise, which we also coach them through for a full year.
When I think of this procedure that's going on, my mind starts to wonder, and I don't know what it's like. What is exactly the procedure like?
The procedure itself is about a 10 to 15-minute procedure. It's similar to having an endoscopy. So basically, the instrument is introduced, into the mouth. The scope it follows the instrument into the stomach.
Wow, look at that.
And then it's expanded to the given size. We acknowledge that it's in the proper position and the right size. We withdraw the scope, and that's basically it.
That's it?
That's it.
It's fascinating. It's totally fascinating, isn't it? Tell us about, you mentioned the patient really needs to be committed to make this work. Yeah. The long-term goal for the patient is what? I mean, this is not just a quick fix.
No,
this isn't put the balloon in and you lose weight and you're done. This is really a lifestyle change.
Yes, it is. I mean, we focus more on the lifestyle change. I mean, this is just a kind of a catalyst to get them to that point. But the balloon, the dietary modification, we have the coaching that happens, which is available 24/7 with this program, where you can speak to a dietitian. They can assess what you're eating every day. And we focus on foods that are nutritionally dense but aren't very calorically dense. And that's I think the pitfall that most of us have is that we focus on high fat, high caloric foods, and not necessarily nutritionally dense foods. So the goal is to teach people how to eat properly, and then beyond just the balloon, once they've reached that target weight loss, they can continue a healthy lifestyle and continue to maintain the weight or lose more weight if they wish.
As Dr. Stephenson mentioned, you're not left on your own. They coach you through the whole process, but this is a great way to get a jump start, certainly. To learn more, visit carolinadigestive.com, carolinadigestive.com. You can also call for a free consultation. That's being offered to the first 10 callers who mentioned Charlotte today. The number is 704 704-372-1649. Again, 704-372-1649. If you're having a hard time losing weight, pick up the phone, call now for that free consultation to find out if you're a good candidate for Orbera. Dr. Stephenson, thank you so much.
Thank you so much.
Appreciate
Thank you for having
it.
me.